Hello, my name is Patrice, and I wanted to talk to you all today about something that I deal with I've dealt with for quite a long time in my life, at least the last 20 some odd years, and it's called migraines. I've had migraines since the age of 14, and I will be 40 in December of this year, so that's a pretty long time. But I wanted to share with you all the information that I did pull up on migraines, and I hope if anyone out there is a sufferer of migraines, that this information that I give on today will help you as well. Okay. Migraine is a neurological syndrome characterized by altered bodily perceptions, severe headaches, and nausea. Psychologically, the migraine headache is a neurological condition more common to women than to men. There is a migraine pain center or generator in the brain. A migraine begins when hyperactive nerve cells send out impulses to the nerves, to the blood vessels, causing them to clamp down or constrict, followed by dilation or expanding, and the release of serotonin and other inflammatory substances that cause the pulsation to be very painful. The typical migraine headache is unilateral and pulsating, which lasts usually 4 to 72 hours. The exact cause of migraines are unknown, although they are related to changes in the brain as well as to genetic causes. There are migraine headache variants. Some originate in the brainstem, and some are genetically disposed. Studies of twins indicate a 60 to 65% genetic influence upon their ability to develop migraine headaches. Moreover, fluctuating hormone levels indicate a migraine relation. 75% of adult patients are women. Initial treatment is with analgesics for the headache and antiemetic for the nausea and the avoidance of triggering conditions. The symptoms of a migraine headache include moderate to severe pain, often described as pounding, throbbing pain that can affect the whole head or can shift from one side of the head to the other. Sensitivity to light, noise, or odors, blurred vision, nausea or vomiting, stomach upset, abdominal pain, loss of appetite, sensations of being very warm or cool, paleness, fatigue, dizziness, bright flashing dots or lights, blind spots, wavy or jagged lines, and rarely fever. Triggers for migraine include the following: emotional stress, sensitivity to specific chemicals and preservatives in foods, caffeine, changing of the weather, menstrual periods, and we all know that's with women, not men, excessive fatigue, skipping meals, and changes in their normal sleep pattern. Also, there are some medical conditions that cause migraines as well, or they're associated with migraines. I'll say it like that. And those conditions are asthma, chronic fatigue syndrome, hypertension, stroke, and sleep disorders. There are many medical treatments for migraines. Migraines are treated in two different types of approaches. abortive and preventive. Let me go back and say there are two kinds of approaches, but there are many different types of medications, I should have said, that can help with migraines. Um, and abortive is the goal of abortive therapy is to stop the migraine once it starts. The prescribed medications stop the migraine when one is coming on, or once it has begun, you may take it as needed. I've been on that medication myself, and it worked, but it was kind of had me jittery a lot because I had to take too much of it. To me, I could. And just real quick, what I had to do was take the medication. I would take it at the onset of the headache, and then I would take one for every hour up to 4 hours to stop it. And 9 times out of 10, it wouldn't even stop it. So. But some of them work. That's just in my case. The medication they had me on didn't work. But anyway, they different names of medications that can be used or that are prescribed is Relpax, Frovia, Emerge, Maxalt, Zomig. There are also some over-the-counter medications that you can get, like Midrin, mid Migraine nasal spray. I've never tried the nasal spray before. Even Advil migraine, Excedrin migraine, which is the one that I use for mine. It really, really helps me real good. And Motrin migraine pain. Also, they give you medication for the nausea, which is called Regalan, Compazine, and I know a lot of the women um, well, a lot of people who've dealt with nausea, they have taken Phenergan. I know everybody talk about Phenergan. I remember the first time I took Phenergan, I was like, hey, I like this. But anyway, okay. Um, Also, there is preventive medications that you can take. This treatment is used only if the migraines occur frequently, and that frequently means typically more than one per week. Sometimes I deal with that. It just depends on what things are going on in my life at that time. Medications used to treat blood pressure, high blood pressure, beta blockers, calcium channel blockers are used to help in preventing the migraine. Also, antidepressants and anti-seizure medications can be used. Different ways of helping to relieve the stress of migraines. Um, we sometimes bring them on. Uh, our active lifestyle allows us to bring them on, and so what we do is take the uh, we take medications and we don't rest like we should. I'm guilty of it, I know. But anyway, different ways that we can stop the migraines. Biofeedback, which is a technique that helps headache sufferers learn stress reduction skills by providing information about muscle tension, skin temperature, brain waves, and other vital signs. Um, Electrodes are attached to the skin and measure the amount of muscle tension or the skin temperature. And that's the biofeedback. I'm not going to go into deep details on that. Also, stress management, acupuncture, massages, herbs, essential oils, and dietary changes. Also, believe it or not, some of our favorite foods, chocolate, cheese, citrus fruit, red wine, can cause the headaches. I remember for a long time I couldn't understand why I couldn't eat a Big Mac. Every time I ate a Big Mac, it gave me this super humongous headache. And come to find out, it was something in the sauce that they would put on a Big Mac that would cause me to...
Who you talking?
I'm doing my homework, Kayla. Go. Go. I'm doing my homework. You want to say hello?
Who's that?
Say hi.
Hi.
Hi. Now go play. I'm but that was the reason why, because I was allergic to something in the sauce that they were putting on it. Back to my homework. Um, Different resources, different places, websites that you can go to find more information about migraines. The American Academy for Neurology, the American Academy for Neurology Foundation, the American Council for Headache Education, and the National Headache Foundation. I hope that this was helpful to someone, that encourage someone to go and get the help that they're needing if they are a sufferer of migraines. I know, like I said earlier, I was 14, probably younger than that, when I was diagnosed with it, but it's something that I've dealt with for a very long time, and it every time one come on, it's like, oof, oh my gosh, I can't believe this. It's very frustrating. It hurts really bad, and it limits you. I remember reading on the website where it said that some of the people who suffer with migraines and they have jobs, the workplace, excuse me, they lose a lot of time, or it takes longer for their work to get done because of people who suffer with migraines and stuff like that, because it really is a big issue. So once again, if you're a sufferer of migraines, I just ask you to just go to your doctor and ask them to run the proper tests that they need to run to find out if you are a sufferer, and if so, get on a medication regimen where you can get the help that you need to deal with the migraines. Thank you so much. Once again, this video is just to let you know what's going on about the research that I pulled up, and this was something that I deal with constantly. Actually, I'm sitting here with one right now, as a matter of fact. But we have to do what we have to do anyway. So take care, and God bless.